amongst the top 3 in the world in terms of porn consumption.
Unfortunately, that's the most easiest accessible thing today for you to know anything to do with sex.
I mean, if you look at Maslow's hierarchy, it's like ghar, khana, pani, intervals. It's core.
India would have not more than 50 andrologists.
In a population of 1.5 billion, we have less than 100 andrologists.
The cultural aspect of the society doesn't allow us to freely talk about it.
Tell me, what is the most overrated trend in sexual health right now?
I think Nofap, men's influencers will talk about it. It's like it's a one-shot remedy for all problems in life.
Some 40% men experience ED issues. There's a massive problem.
Psychology-led erectile dysfunction is very common.
Gen Zs are having less intercourse than millennials at that age, right? Which is pretty surprising.
People suffering with sexual health, trying all the lotions and potions and everything, buying Viagra out of the shelf. All of this is because they don't want to talk about it and they want to solve it by themselves.
And even when we approached Johnny, that was something that we wanted to get across, that actually anyone can face these problem statements.
Alright, welcome back to another episode of this podcast. Today we're going to talk to two founders who are building in a category which is very underrated and not spoken enough, sexual health. We're going to unpack a lot about what sexual health means in India and what it takes to build two upstarts from scratch, which consumers are going to know more about. Pranay and Rajat, welcome to the podcast. We'll get started with a quick intro of each other.
Thanks, Dilip, for having me here. Quick intro about myself. I am Pranay. I am a founder and CEO of Allo Health. We run a chain of sexual health clinics, both physical chain of clinics across multiple cities now. And we also have a digital consultation arm where we do digital consultations across the country.
And how long Allo has been there?
We started early 22. So It's been almost close to 3 years now that we have been doing this. Yeah.
Great. Rajat?
Yeah, first of all, thanks for having me. I'm also the founder of a sexual health company. It's called Boldcare. We started about 5 odd years back now, so it's been a while. What Boldcare does, it's a set of products that goes from, let's say, sexual health to sexual wellness, right from, let's say, solving problems like ED, PE, erectile dysfunction, premature ejaculation, to condoms and lubes as well. I mean, largely, you generally don't hear a lot about sexual health and wellness in the zeitgeist, so pretty excited about this.
Yeah, so first thing first, this is a category which is not trendy. It might be sexy from outside, but not very exciting for people to go and build, right? So, what was it when you guys started off? Told your family and friends that I'm going to build a company in sexual health. What were the reactions?
For me, I moved out of Ola in 2021. I had only one thing that was clear in my head when I moved out, that I'd kind of just relax for some time and then start something in healthcare. What exactly, I was not sure. That was the time when I was exploring from a very first principles point of view on, what can we do in health, and as a consumer, me, people around me, what are the problems that they have vis-a-vis, the solutions that existed, which are more supply centric, etc. And realize that mental health, sexual health, smoking cessation, addictions, etc. are things that a lot of people around us have in common, but don't have like real solutions or clear solutions or clear places to go to kind of seek these. Mental wellness was kind of growing, but still very small. So I started researching on that, and I was at my home. So when I stumbled upon this, started my research around sexual health, and I reached out to my brother, asked him कि यार मुझे एक sexologist से मिलना है. I think the immediate instant reaction that he had was किसको क्या हुआ? And I was like, I just want to study, and I did that with like a couple of other things. I tried CGMs to figure out how the overall health understanding is what I was building. So I think the stigma associated with the category and just the word and just by asking for a sexologist was such a big thing. So I think that kind of still have an impression. That was the first reaction that my brother had. And I also realized that it was clear that this is what I want to do when I said this to my parents. For the longest time, they didn't tell anybody that I used to I run a sexual health company. So if anyone asks them, what is he doing now? And that is like a hot topic because I left Ola, it was all in the news, etc. And my parents were like, "वो health में कुछ कर रहा है. He's doing something in health." And you know, after a year, I kind of sat down with them and I told them, "Okay, this is exactly what I do. You probably know this, but I'm just calling it out. So if someone asks you, this is what you should say." And then I think that assimilated, and now they are kind of open about it. But I still remember what he said in like a closed room setting. He said कि अगर ढंग से काम करोगे तो बहुत लोगों की दुआ लगेगी.
You have products which are on the shelf, so it's very evident, unlike what he's doing, which is more on the services layer. What were the reactions for you, your parents and family members?
I think it's the fact that I was very young. So I started this when I was 23. I just turned 23 then, that I really didn't think twice about it. So, you know, I've discussed this with my co-founders much later, you know, in the second, third year of my journey, that maybe that realization came then, ki, are, you know, do people see us in some different lens or something? But when at least 3-4 of us started, right, just had no, at least I had no inhibition about it. Surprisingly, my parents also didn't have any inhibition about it. My dad, like, you know, a very good problem to solve. It's a very large problem statement. Nobody is doing anything. Good, go and try to, you know, figure out if you can do something in the space. So at least for me, right, I didn't have any such stories where I had like inhibition, worry about the category I'm in.
So it's a age market fit. People talk about product market fit, right? Age is on his side.
No, I don't think I was thinking much.
Not married. Here you're married. So people will ask more question why that's a problem. So no, I mean, jokes apart, I think the reason why I popped this because that initial inertia, which largely comes from the societal layer, right? And that is the first friction which founders have to jump through. Supporting, but they can also pull you down, right? So that again varies from people to people. But tell me, in your case, what was that moment then you realized that this is something which is a venture scale opportunity? Like you can build a large company. I mean, what were the trends? What were the opportunities and white spaces you saw which said that, okay, you can build a large company out of this?
I started an e-pharmacy business very early on, right? So none of the big guys that you would know now, none of them were live. And we were very naive, you know, it was a sort of a shit-looking app that we had started with. But for some reason, this category used to be our biggest chunk of, let's say, orders that we would get, you know, almost, you know, good 45
what category?
Sexual health. And again, you know, we were just
and
aggregators.
What products?
So everything, you know, right from, let's say, a Japani oil to, let's say, condoms, contraceptives, tadalafil, sildenafil. I left that. By then, I had sort of dropped out of college. So I figured instead of going back to engineering, maybe it makes sense for me to jump ship, get on the VC side of things. Spend 2.5 years on the other side. And I was speaking to, you know, one of the largest sort of consumer healthcare companies in India. And the gentleman there was telling me that for them, still in their 15th year of operations, almost 17-18% of their total searches were sexologist searches. You know, it's like one of the largest doctor aggregator platforms. So for such a you know, for a company that's about 15-16 years old, if about 1/5 of their business is coming from one single category, and I at a very early stage in a company that never really caught a lot of scale have seen very similar data, that sort of clicked in my head. Okay, this is very interesting. You know, how many other companies are there in the space that, you know, see similar data, right? And what you will realize is, there are going to be a lot of consumer healthcare companies for whom this is going to be like a top 2, top 3, top 4 categories. I'm talking about the aggregator guys, right? And they don't take a stance on what is the right solution. Is this Japani oil or a Unani specialist the right doctor to go for? They are just an aggregator. But, you know, there is a lot of inbound interest coming in, right? So that became like the first lever in my head that it's a problem to be solved online. You know, it makes sort of logical first principle sense. It's the best possible way for me to get across to a customer, you know, with least friction, right? So that became like the first step for me. We spent a lot of time meeting a lot of the sort of best andrologists that you're going to find in the market. What you'll realize is, first of all, these clinics are packed, and, you know, there are few of them. There are not a lot of good andrologists that you will find even in metros. Outside
By the way,
of
what
metros,
is so the medical practice for this category is andrologist. There's nothing called sexologist, right?
Yeah. Sexologist is a loosely used word, but let's say the most common problems that people talk about, andrologist is like a super specialization for a urologist, right? So they only deal with one part of it, the physiology of it. Okay. But the large part of the problems that we deal with is mostly psychogenically induced or psychogenic in nature, right? Okay. So I think, I mean, what we work and do, and we'll talk a lot more on that, is with psychiatrists.
Okay.
Right.
Yeah. Okay. So andrologist is agnostic whether of the gender, whether it's male or female. If you have any, it's only for male.
Largely male.
Okay.
But India would have not more than 50 andrologists.
50?
Yeah.
I tried to count the good ones. I got to 65.
What are you saying?
We met almost
in a population of 1 close to 5 billion, we have less than 100
good
andrologists?
Yeah, it's very few.
Why?
Most actually end up doing urology, So like a good endocrinologist, diabetologist, general practitioner, psychiatrist, urologist, they will all be able to do, let's say, at least the good ones will be able to do a consultation in this space. But, if you're looking at that specialization, then it's an andrology. And there are very few fellowship programs for andrology actually in India. I think that is maybe one of the main reasons.
So is it that we don't have medical colleges to give
I think
that
doctors
education?
just go towards urology. Yeah.
Overall, healthcare is very hospital-centric and very surgery-centric, right? Hospitals, Penile, even for public companies, the first thing that you see is bed utilization, etc. Sexual health and sexual disorders and sexual dysfunctions largely are, treatable to the extent that you don't need surgeries in most of the cases. So it has never been like a very lucrative options from a hospital P&L point of view. Like less than 0.2% of the cases would go for a surgery, and that is also not with a very high success rate and is also very expensive. So 50 andrologists, and I might be wrong, 50 to 100 andrologists is probably sufficient for the country, right? From that lens. And andrologist is, the specialization after you do urology, and urology is like part of like between MD, MS. So, and then you do like multiple types of specialization within that. But if you look at, what is the need and what is the solutioning around it that exists, I think it's largely non-IPD, consultation first, medication, therapy sort of an approach, which almost every, general physician does in some capacity. Alternate medicine doctors do in a big way because there's lack of, credible sources to go to in. And the problem is that erectile dysfunction or premature ejaculation, if I speak about, are the final outcomes of the problem. This is the final thing that you see, but the root cause could be multiple. It could be hormonal in nature, it could be physiological, it could be psychological, it could be, something around the nerves. So for different things, you have to look for different specialities, and that is why it is highly fragmented. So because of all this, the entire ecosystem is almost missing, right? Hospitals don't consider this as a priority, and hence doctors don't get trained in this, because even if they want to set up their own clinic at the start of their career, they would want to associate themselves with some hospital to kind of get some minimum basic earning, getting some client base building, etc. And because they don't want to get trained, even if they want to, they don't see career opportunities, they don't want to get trained. There are very few institutes which train, on sexual medicine, and it's a vicious cycle. And because of that, there are no institutes which churn out sexual medicine. Sexual medicine is a branch of science which is not recognized in our country, right? And I think that's the grassroots level issue, because we don't. And sexologist is just a word and not like a.
No, but I was looking at the data. You said even let's say by that count of let's say 100, even if you multiply 10 times, even you say 1,000 at the max, that's still. It's not enough. The data, I had the data say that almost 1 in 10 men in India experience ED issues, right? That's around 50 odd percent of the population. And some 40% men by age of 40 have this issue, right? So there's a massive problem, right? So 1,000, even if you get to 1,000,
it is definitely not 1,000. So see, there are around 12,000 psychiatrists in the country. There are about 4 lakhs, and I might be wrong, more than like a few lakh MBBS doctors in the country. Sexual medicine falls under precision medicine. So if you know the diagnosis well, there is a very high likelihood of successful outcome, right? Desired outcome. So, and it is not rocket science. For an MBBS doctor and for a psychiatrist, like we in Allo run a course where it's a 60-hour course, which methodically we take them through, the different diagnoses, the different pathways for treatment, etc. Then we kind of put them out to kind of help patients who come on our platform. So it is a branch of science where the science exists, it's not practiced enough, right? Hospitals don't cater this. They also kind of not look at it in a very good sense or a good way. Plus, alternate medicine is so big in this. I mean, India has 70,000 quacks.
Yeah.
Right.
Wow.
That means if you map it out on the map, every 2
So there's
kilometers.
a data around quacks also, that in terms of numbers.
These are largely our projections and understanding. Like, unless proven wrong, I continue to go with these numbers. Every 2 kilometers, there is someone who is claiming to solve for the Gupt Rog, right? Because the latent need and demand is humongous. And like you said, I think you were referring to Practo. All the platforms which list doctors and similar services at the time of their peak, be it Practo, there was an MFine, Librate, MyUpchar. Eventually, I learned that all of them had sexology and sexual medicine as the top 2 or 3 categories.
Every Ayurveda doctor on these aggregator platforms will have sexologists as a tag, no matter what they do. So, like every single one of them, because they know that is where they're going to get most of their volume from, right?
So the gap is filled today with alternate medicine, which is Ayurveda, Unani, Siddha, homeopathy, and every MBBS doctor, every diabetologist, not every, most of them would also treat it.
Yeah.
In whatever understanding and ways that they would want to treat it. The good part about this is that it is not rocket science, right? It is something that someone who has, like a psychiatrist has spent 8 years, an andrologist has spent 10 years studying, MBBS doctor has spent 5 years studying. They would know like the basics of it, and like with a 40, 50, 60 hours of training, they can solve for the 97th, 98th percentile of the problems, and then the rest of it can be escalated to like a more nuanced experts.
Let's understand the science part of it. Okay, so the data says that it's a common issue, right? Why does it happen? What are the reasons that cause it? Why do men experience ED issues?
We can go through multiple root causes that are possible, right? I mean, if somebody is young, I'm assuming the most probable case is it's a psychogenic problem statement, and there could be multiple
What
reasons.
What does that mean, psychogenic?
So, I think, so for example, the stat is that the highest average age for first intercourse in the world is in India. So I could be wrong, but it's around 26, 27. So that is when sort of an average guy is having, sex for the first time. It could be porn consumption, it could be anything, but they have sort of built up that event in their head, which is where when they're in the act of having intercourse with their partner, maybe they're not able to perform because they're really stressed out on, how am I going to do, what is going to really happen, will I be able to perform or not, right? And that leads to you, let's say, having a erection issue when you're in the act. A good way of knowing it is maybe, and again, it's not an exact sort of 1:1 there, but like, if let's say you wake up in the morning and you're getting an erection, that means biologically all systems are running, but then when you're in the act, you're not able to have an erection, right? So that's like a good gauge of, okay, you just build it up too much in your head.
And you said highest age, what does that mean? Like, I mean, 26 you said. So is
that's
that the
average
latest?
age of first intercourse. The average age for somebody having first intercourse in India for men is around 26.
It means around the world it's earlier?
Oh yeah.
Oh, okay.
I think India has the first or second highest average age. Yeah.
So that means we are
having sex later.
Okay.
Yeah.
So you want to say that there's more pressure when you're kind of doing it later.
A lot of men have their first intercourse after getting married, for example, and that puts a lot of pressure on them. So that is like maybe one reason.
Okay.
The second.
And that's where you said that a lot of treatment, what you do, is where.
Yes. A large part of it
psychotherapy approach is there.
Then maybe moving a little bit, what else, like cardiovascular issues, right? I mean, ED, at least the way I see it, it's like a red siren going off in your body. If you're having an ED issue, it's worth it to figure out why are you having it. If it's a psychogenic issue, then you need to go there and solve it. But let's say if it's not a psychogenic issue, like a very common, at least situation that we have seen, it could be lifestyle factors. That one, let's say, you're smoking a lot. Like smoking is tremendous red flag for ED. Smoking, alcohol are like really, really big factors. Or, you're not working out, let's say. Your cardiovascular health is gone for a toss, and that is leading to you, let's say, having erection issues, right? So ED is like an early indicator of your cardiovascular health is like, maybe not that good, and you need to really sort it out, figure out what the reason is for you maybe not being able to perform.
Generalize it to say that if you're not staying healthy and fit physically or mentally, there are higher chances of you finding yourself into a sexual health issue.
Yeah.
I mean, there's one more aspect to it. So one is the physical health, mental health, and I think hormonal health is also an important
Elaborate. What does
aspect, right? So I think the physical and the mental aspect is the physiology of it, and which is because at the root of it, what is happening at erectile dysfunction? Your penis is not getting the blood flow it should get after you have had the arousal, which is like a phase in the overall scheme, right? you're not getting it either because physiology mein there is a problem, and which is what is linked to cardiovascular disease as well, etc. Right. The other part is your brain is not signaling that you should do it, and third is your hormones are not kind of enabling that to go right. All three of them in some combination or independently can be at play. So, for example, people who have diabetes, there is a very strong correlation of that with erectile dysfunction, right? I mean, it is said that over the course of time, 66% of people who would have diabetes at some point would develop ED at some point in their life, right?
But they may not know that they're experiencing that.
For anyone who has, been till the age of, let's say, 35, 40, at least once in their life, 1 out of 2 or 2 out of 3, at least once in their life would have had the second doubts around their quality of erections and the timing around ejaculation. And the root of this goes back to setting the benchmarks, lack of sex education, lack of sexual health awareness. We have absolutely none of that in the country. And I mean, I'm glad that with social media coming in over the last 4 or 5 years, it has kind of exploded in a good way. But prior to that, I mean, I'm sure none of us got the sex ed that was supposed to get in schools, and half of the states have banned it. So
states are banned it.
I mean, sex education is I mean, it's not in a lot of states. At least 4 or 5 states have outrightly rejected that, right? So, I mean, on one side, government is doing great work on controlling HIV/AIDS and creating awareness around condoms, etc. But I think the root of it is most of the millennials at least have learned about their sexual health or sexuality and discovered their bodies either talking to their friends or reading on the internet, which half of the time is not true, or through pornography. So I think people don't know what is good and what is not good, and there's a lot of curiosity, and the cultural aspect of the society doesn't allow us to freely talk about it, right? And all of this, along with the factors that he mentioned, like at the age of 26, if you're having intercourse for the first time, there is likely a thing going in your head whether you are going to there is some sort of an anxiety there. Plus, our lifestyles have also changed.
So, I mean, there was a data which I was reading that even the sperm count, over the last 30, 40 years have halved. Since the 1970s to right now, globally.
I think I'll just add one more thing to, which ties into this on the hormonal side, right? So for example, the testosterone rates in men, right? I mean, the standard, is going to be about 250 ng per DL to about 850, let's say, in the early 30s, starting to have like low testosterone, right? And due to like multitude of factors, which leads to like SHBG, LH, the estradiol, everything going off for a toss. And then what that leads to is, they don't have enough libido, they don't have enough desire to have an intercourse, which is like a vicious cycle. I think it's a mix of like lifestyle, environmental, personal factors. The environmental is like endocrine, disrupting chemicals, for example, right? You'll find pesticides in food, like nanoplastics in food, right? That is one. Air pollution is going to really start having an effect, right?
Air pollution can impact your ability for sperm count?
A lot has changed from, let's say, a decade or 1.5 decades back. Our lifestyle in terms of the activities, the amount of time that we're sitting versus the amount of time that we are working, walking, etc. has also significantly changed. The air quality has changed. Overall,
as simple as sleep,
sleep, microplastics that he said, right? Nanoplastics, etc. So all of this combined, globally, fertility rate across genders have been decreasing. The need to check for fertility and testosterone levels, etc. has also increased off late, when people are marrying and having kids a lot later than before, right? So I think that also adds to and compounds the overall problem. Earlier, people used to have kids when they were 25. Now it's 35 is like the new 25 when it comes to planning, at least in tier 1 cities, and I'm sure that's kind of percolating as well.
Interesting, right? I mean, when we correlate with the fertility rate, for sure the rates have come down, not just in India, worldwide, right?
I know anecdotal cases where men have not gotten into relationships because they know that they are facing, ED as a problem statement.
Lack of performance leads to low confidence, and that spiral leads to anxiety and then low libido, which is the need or the desire to kind of have an intercourse or sex in general, right? Which is like the induced libido problem, which leads to the problems that you're discussing, men or women for that matter, not wanting to get into relationships, not wanting to have kids, not wanting to talk about it
Because of their anxiety.
and leads to like kind of stress in relationship, etc. All because of anxiety of performance. One form of this that we see a lot is unconsummated relationships, right? Where two individuals are happy in their life as partners, and then the eventual FOMO and the body clock concept kicks in, and they want to kind of procreate, but they have never had sex or successful intercourse. That is a very prominent and a very common thing that we see couples coming to our clinics or even online, sharing about how they have been trying around it for so many times, and it has taken a toll on their relationship.
Pattern is specific to tier 1, tier 2 or agnostic?
Cuts across.
Oh, wow.
It cuts across. And this was one of the things. I mean, if you actually, and I've done this experiment a lot of times, if we think about 20 individuals plus minus 5 years of our age bracket, you would know at least one couple struggling around this. And because of the stigma, they don't want to talk about it. Even if you want to help, oftentimes people don't reach out or at least proactively say that we can help, etc. And that goes into like a negative spiral and a vicious cycle, right? Now, this is something that we address a lot in Allo. I mean, people coming in and then we diagnose what is the issue and what is the root cause.
But how is this pattern? I mean, that earlier point which you were saying on porn consumption, that if there is not enough interest to get into physical intimacy, I mean, the data on porn consumption was that India is amongst the top 3 in the world in terms of porn consumption. And amongst the Indian porn consumption users, 30% are women. And this is data out there. Now, where does this fall into the spectrum of either leading to a certain psychogenic issue that you're consuming content and therefore you feel that's the performance level what you want? How is this connected to, let's say, the health?
For a lot of men, porn consumption is, it's a judgment-free way for them to, let's say, even if they're having ED as an issue, right? So you don't need an erection to ejaculate. You can still ejaculate, but you need an erection to have intercourse, right? To have penetration, right? For a lot of men, what ends up happening, and again, this is a big generalization, but for a lot of men, what ends up happening is porn becomes like an easy outlet for them, where it is not, nobody's judging them, nobody knows if they're having any issue or not. They're getting that dopamine hit, they're getting their sexual sort of relief out of it as well, at a very, very low cost. And that becomes like a vicious cycle where they start it becomes like an addiction for them, right? So that is one. It could be where the porn came first and the problem started afterwards, or it could be that the problem came first and then the porn addiction started afterwards. But that does happen quite often, right? I think we consume so much porn on phone. Like that was the data I was reading.
Yeah, because easy access to internet.
It's an insane amount of porn consumption that happens. But my main issue with porn consumption is that it becomes an easy outlet for men to get, let's say, the natural desire to have a sexual sort of discharge without the effort of being in prime health, having a good sort of sexual function going, putting that effort to be in a relationship with someone, and eventually what will lead you to be more satisfied.
We can't disregard the fact that there could be men after being in the relationship or after being in a marriage could also be having a porn consumption, right? So so my question is that how do you kind of figure this out, that okay, what is leading cause of porn consumption and how is this causing the sexual health issue?
My understanding and our understanding is that porn is largely consumed for 2 reasons, right? I'm not saying which one is big, which one is small. One is education.
What do you mean by education? Like people are consuming porn to educate themselves.
I mean, if I ask you, how did you get to know about, let's say, masturbation, right? No one would have asked you this question ever, right? And I'm sure that is, everyone has their own path of self-discovery around masturbation, right? So I think there is some amount of value. It is purely because we live in a society where there is no sex education, right? Then, for anything which is behavioral, right? And porn is one, gambling is one, shopping is another one. So there is use, there is harmful use, and then there is addiction, right? So long as it is in the use bracket, it makes sense, right? And because you're using it to spice things up between you and your partner, or by yourself, you're using it just to pleasure yourself without causing any harm to anyone, including yourself. And when it becomes an addiction, that is where it becomes a problem, right? I think compulsive masturbation is an outcome of that, right? And watching porn and compulsive masturbation and porn addiction go very hand in hand, right? Compulsive masturbation is something that needs a diagnosis and a way to treat, just like any other addiction would. But I think watching porn on a regular basis to self-pleasure yourself, to explore new dimensions of sex with or without your partner, independently or together, is something which is very, very common, and I don't think it has anything to do with the problems that we're talking about.
But those are independent issues.
Those are independent issues.
I think the only maybe way I would slightly differ there is, I think that makes a lot of sense, right? But the problem sometimes happens that kids who are as old as like 14, 15, 16, when they start watching porn, my main worry with it is that, it's an easy source of dopamine for men. I mean, I was reading a stat, it's globally true, I don't know how true it is in India, but Gen Zs are having less intercourse than millennials at that age, right? Which is pretty surprising. I mean, you would have never expected something like that to be a data point. But that is my main worry, that when you start so damn young, then do you start sort of letting go of that harder path of, finding somebody, being presentable and being in a relationship with someone, having, as I said, right, a good sort of, sort of healthy functioning body. You maybe switch that off when you say, okay, I can watch porn for like 15 minutes, 1 hour, whatever it is, and I can get that daily discharge out. And I think men will not realize how big of a factor that is until they're like much deeper into it. So that is maybe like one caveat there, right? I think porn consumption, I also do agree, I don't think inherently there is fundamentally anything like horrible about it, but because there is no education, nobody's
So you're
taught.
saying the porn consumption is not a bad thing?
I think when you're old enough to know what you're doing, I think and when you know you can manage it, so playing poker once in a while is good, playing poker every night and you losing a tremendous amount of money and you're borrowing money and then you're still playing it because you have no self-control, I think is a horrible thing. I think it becomes easier in gambling to sort of understand when it is a bad thing, because we have been taught enough in terms of gambling that now this is bad. Like you yourself know, you will maybe still not stop, but okay, this is now becoming a problem for me. I think in porn, because just nobody talks about it, you maybe still know in the back of your head that what I'm doing is not correct. See, this is now, we're getting into us or me knowing about whatever it is by having to speak, with men who are having the problem, right? So it's not data backed.
But it has to be more than that. I mean, it's hard to believe that if India is amongst the top 3 in terms of massive
we are also
population
1/6
size
of the world.
Population, we're top 3 for everything.
Right. So in that count, if you see, it can't be just for education purpose. I mean, there was a data
it is
saying
definitely
that
not just for
teens are on an average consuming 7 hours of porn every week. That's clearly not education.
So that is definitely on the addiction side,
Yeah.
right? So you're watching it out of curiosity. Yeah. You're watching it to pleasure yourself.
But you don't realize.
And you're watching it because you are addicted to it, or it's you compulsively, right? What you're saying is it's not a step, it's a slope, right? But unfortunately, that's the most easiest accessible thing today for you to know anything about anything to do with sex or sexuality.
But is there a correlation that watching excessive porn can actually cause or lead to sexual health issues?
The challenge with watching excessive porn is wrong expectation setting, right? And I think
because that is, for example,
I think
initially you
it's
said
slightly deeper than
the
that.
anxiety issues, the performance issue. You're watching someone, ideally a performer, right, who might have, of course, different abilities and capabilities, and therefore you as an average Joe will realize that you cannot at that level, and therefore
so the expectation setting mismatch is, and because we're not aware, people come to us saying that my ejaculation time is not more than 10 minutes, what should we do? And we say that there's nothing that you have to do, right? So that is what porn leads to.
therefore a psychological approach to solving it.
Just the point there would be that I do agree with that, but I honestly feel it goes deeper.
Tell me, what is the most overrated trend in sexual health right now, which is very hyped, but in your practice you think it's very nonsensical?
I think Nofap, I think I've seen like all sorts of studies on Nofap movements, right?
What is Nofap? Elaborate.
So Nofap is basically not masturbating. I've seen all extremes of it as well, because I've gone deep into that rabbit hole to figure out, is it even, is there any sort of science backing it? From whatever limited data that is out there, it's like if you fast for sexually fast for about 3-4 days, right, there is goodness that you can get out of it. But I think after the 5th day onwards, it's, you're not biologically sort of designed to not it's a very natural sexual function to go and have, to ejaculate for a man. I think the way Nofap is sort of positioned or put into the zeitgeist, or the sort of the way, men's influencers will talk about it, is like it's a one-shot remedy for all problems in life.
It's a very common thing. And thankfully, I'm glad that over the last 3-4 years, we have these sex educators which are big on Instagram, YouTube, with millions of views.
So what does it mean? If they have million views, that actually means there's a market.
Now, people are not going to read research papers, etc. So how do you trust what information is right and what is not? Is the biggest mystery to figure out.
I'll talk more about when you guys decided to build out on the business side, how you did it. But, just on this topic, while we were discussing on the addiction bit, and porn was one of it, right? What about other forms of pleasures where there is either a correlation or causation? Is there any enough research or study done where there is any correlation to say that if you are smoking or any other form, vaping, it can lead to any form of sexual health issue?
I think there is more than just way too much research done, and there is just no
direct
doubt
indication.
Is it?
No doubt. There is absolutely
it can
no doubt.
lead to sexual health issues.
In my view, it will eventually 100% lead to it, because you will mess your cardiovascular system up completely, right? Eventually, if you're smoking like one cigarette and you've just started smoking like 2 months back, then I'm assuming you'll not have any effects out of it. But if that keeps on continuing, right? 5-6 years, if you've been smoking, I think early indications do start coming in. The longer you go, the further difficult the problem becomes. One sort of good point to that is, if you stop smoking in a month or in 3 months, you start getting the goodness out of it. You start realizing how good your sexual function is becoming. So it's not that, I've been smoking for 5-6 years, it's now, what do I do now? It's gone, right? You can just stop it for 2-3 months and you realize how much better you are. But there is absolutely no doubt, it's in my view maybe the biggest factor for one of the biggest factors for like your cardiovascular health going for a toss, which is basically going to mean that you're going to have erectile dysfunction that is going to happen. I think smoking is like literally the worst thing you can do in my view. And I think, and I can agree that maybe there is not enough data on vaping right now, but I think there is no difference between vaping and smoking. You are inhaling, the chemicals that you are getting in your body when you are, so when you're smoking cigarette, you're getting tar. And I don't know what the effects of that are going to be for very, very young kids who are starting to vape. What is going to happen to them in 5-7 years if they don't stop, right? If they keep on doing it. But there is like no doubt whatsoever at all that smoking, it's a 1:1. You're going to have erection. Smoking is the first thing I would tell anyone to stop.
For sure. Not just for sexual health. Just for your overall health, right? That's the single most impactful thing what someone can avoid.
That is a very, like you said, both smoking and alcohol have a very direct correlation to sexual health. For us also, for almost every patient, and we don't say stop because we know it's difficult. We say try and reduce it as much as you can, and then figure out ways, medications to circumvent that. But it has a direct correlation.
But tell me one thing. Most of the conversation so far has been very male specific. I want to quickly shift in your case because you're looking from a clinical approach, right? What are the patterns and trends in women? Because sexual health, it's age agnostic, right? What are the reasons? What are causing them sexual health issues, and what is that?
I think the common issues that we see for females is generally around two, which is low desire and vaginismus. And again, both these two cases are very intertwined and correlated with each other. Vaginismus is a situation where you eventually and vaginismus, an alternate to that, not 100% one-to-one mapped, is also pain during sex, right? So these are very common problems that women faces, when it comes to sexual health concerns. Although, our platform is very skewed towards men reaching out, we see enough and more people around these 2 or 3.
Is that generally a good signal? Because if men are reaching out, what does that mean? That there isn't enough demand, or people are not making an attempt because of, again, cultural nuances?
I think it is more cultural and the need to solve and the realization of the need to solve and the independence to kind of go out and solve for it.
Right.
Like our clinic in Indranagar has about 15% females walking in, but our Mysore clinic from the last 1.5 years has only seen 2 female patients. So I think, I mean, how much ever we don't, we would
Yeah, it's a
not want it or
cultural-
like it, it is a lot more cultural and, you know, in the context of the culture that you are a part of, which changes rapidly. But yeah, if you ask me, is it like a grave problem? It is. Should women go and solve for it or at least understand it? Definitely. Are they doing it enough? Probably no.
Do we have enough data or research done where women, because of their biological changes, they go through a lot of hormonal aspects as well, right? So that has any impact or correlation in their desire around sexual intent? I mean, is there any correlation?
I think a lot of sexual desire or libido is it's very closely linked with your hormonal health. I think the testosterone rates, the estrogen, estradiol rates. It's like if you go to a good doctor, I think, and low libido is a problem you're facing. So I think the first thing they would say is, let's look at your hormonal profile right now, and what is going on.
There's a lot of invasive, non-invasive surgical interventions which happen, right? Tell the audience, the world around that. What happens? What are people doing it? What is generally your observation? Because you're reading a lot.
Yeah. No, I think what we were discussing was that a lot of what happens for sexual dysfunction treatments is non-surgical in nature, non-invasive in nature, which is if it is psychogenic, then you use a combination of medicines, therapy.
What you're doing at Allo.
What we are doing largely at Allo. You kind of eventually supplement it for sustenance and for well-being. Then there is another dimension of pleasure, which is how do you kind of spice things up, etc., which we're not getting into. So there is illness, there is wellness, and then there is pleasure, right? Within that, to my understanding and to our understanding, like 97, 98% of all sexual disorders and dysfunctions that we deal with is something which can be solved using medication and therapy or a combination of that, right? Less than 1% or about 1 to 2% would require some surgical intervention or some evasive technologies, which are in some cases still under development. In some cases it is widely used with or without like a clear understanding of how good or bad it is. And we were talking about stems, we were talking about Botox, etc., that people do. I think the last thing that I have learned, which we obviously don't do, but I know that there are doctors in India who do that, the fertility experts and andrologists who do that, is penile implants, right? And penile implants is
what does it mean? I mean, for average Joe, what does it mean?
It is where you actually go through a surgery where you have
cosmetic enhancement.
Not enhancement, replacement of the glands. So basically, if you look at the entire act of sex, there are 4 stages of it. There is a desire, then you get an arousal, then there is a performance, and then there is an ejaculation, and then there is a retraction time or a time for you to kind of be ready. In a lot of cases, these 4 stages exist, but there is problem in the 3rd stage, right? Which is where a penile replacement or a penile implant works fairly well. It is a very expensive and a very, like I was referring to 0.2% of the cases actually have to go through a surgery, right? It is that 0.2%.
It's a desire driven or need driven?
Some people are actually going to be non-responsive to PDE5 blockers, and if you are basically going to be a non-responsive, like for the the medication is going to be some form of a PDE5 blocker. And if you
what does PDE5 blocker do?
Basically it improves, like in sort of layman's word, it will improve the blood flow into your penis. And I think
there's a validation to its efficacy.
Sorry?
Yeah, there's a validation to the efficacy.
Yeah. Okay. And then let's say if you are in that, let's say 2-3%, I think then there's step 1, and he mentioned, right? I think stem cells is the new thing that people are trying. PRP shots are something that people have tried. Shockwave therapy. It has limited benefits, but the step after that is basically a penile implant. But
yeah.
Now, is it safe? I mean, less people are going because it's. I mean, the fact that it's safe or unsafe is not known,
I think
or is it because of the cost factor?
In a lot of cases, it is not a compulsion, right? It's a thing that you want. It's a sort of a discretionary, right? It is expensive. It is not very common, and it's not like it is 100% safe. Or it's too early and too new and too expensive. and also not like a dire need for anyone, right? I know there are clinics in South Korea and Madrid has a couple of them, which have like a luxurious studio kind of a setup, and they fly in their clients from China, Japan, and other parts of the world, and that's like $1 million sort of a trip where you go through the entire penile implant as a luxury 5-star sort of a thing, right? But at the end of the day, the surgery that you do is similar to what a penile implant surgery that you would get done in Bangalore, for that matter, right? We have a lot more cheaper options, but it's a very rare thing to do when it comes to the overall landscape of how many people actually go and opt for it vis-a-vis the number of people who are suffering with, let's say, sexual dysfunction. PD5 inhibitors are basically, just to add to that, right? Your penis needs that blood flow to maintain that erection. So there's this nitric oxide, and then there is PD5, which kind of combines with nitric oxide, and you kind of get the erection. I mean, you lose the erection. PD5 inhibitors kind of hold, the PD5 to kind of react with nitric oxide and help you maintain the erection. That's the basic science of it. How you do it is through PD5 inhibitors in the short term, and then eventually to have better lifestyle, better mental health, controlling that, better nervous system, to kind of eventually do it in a more sustained way beyond medicines.
And what's the trend outside of India? Like you said, it's not common much in India, but globally is this is not.
In some cases, it's like so what ends up happening is, if somebody has gone through enough treatment sort of modalities, that I've tried this, I've tried A, I've tried B, I've tried C, and there's just like no option left for me. And those are the cases where I've seen people really go for like penile implants. It's not, I don't think any doctor would like readily even recommend it. This is what you should go for. They would really at least spend 5-6 months trying to figure out what else can be done, and maybe at the end of it say that, okay, maybe this is something you need to go and try.
There is another condition I just recalled. There is a state called micropenis, which is again a case where it is recommended, because I think all of us should know that there is no way to kind of increase the length of the penis, right?
But that's how it's been sold, right? I mean, the
all
banner ads and everything which comes
lotions,
out.
potions are all sold. I think so micropenis state is also often addressed or recommended to directly kind of go through a surgery.
But is this also, it's interesting you bring that. I mean, is that also a cause which has been coming as more as a desire and want, because you are watching and consuming content where the visual impression is that you need to have a certain size, and when you realize that you don't get it, people are playing only a vulnerability that you can get it by using a certain products.
There is nothing that is scientifically backed which can do anything about the girth or the length of your penis. There is absolutely nothing. Even a penile implant will not have actually an impact. I could be wrong in terms of micropenis and the possible sort of solutions there, because micropenis is a proper, let's say, a biological condition, and I'm assuming there will be certain sort of solutions there. But even a penile implant is not going to do anything about the length of your penis, right? That is not really going to change. There is no solution to the length problem statement. Unfortunately, that's like the easiest selling point. So, a lot of the quacks will go for that, there is this cream, this oil, this gel, whatever the hell it is. But there is no...
I mean, technically for length, there is nothing that you can do to increase the length as such, but technically, penis is also attached through a ligament, right? So some of the surgeries, what they do is kind of remove the fat from that area and push the ligament out, which can perceivably increase the length. But I don't think that is desired or that is required.
Tell me, what is this one thing which is underestimated of this category of sexual health, which you only realize after you started building a company in this category? What is really underestimated? It could be market potential, it could be...
The TAM that you were talking about.
Yeah.
Right? I think...
it's a massive...
It is way more common than all of us would think.
What is common? The problem statement is common. And therefore the opportunity to build a product is bigger.
Yeah. I mean, the opportunity to solve this problem at scale is humongous.
But I'm surprised
and
why...
I think the average age of men and how young they're starting to face the problem statement, I really think the average age in India is going to be closer to 30 for these problem statements. If I have to take a layman and ask him, what do you think who faces ED, if they're not facing it, their first guess would be, if you ask like a 22-year-old kid, I think his or her answer would be, it's like a 40 plus problem statement, right? But
That's much. I mean, we have a lot of data around the demographics and the diagnosis because I mean, for every consultation, there is about a 70-point checklist that we see and analyze, right? So, like you said, it is perceived to be a problem of the old, but it is not the case because problem of the old is more around the physiological part of erectile dysfunction, right? But this psychogenic ED or psychology-led erectile dysfunction is very common, and it is between the Gen Zs, millennials, and it cuts across largely all age groups which are sexually active.
So it's surprising to me. I mean, one way it's a common human part of your human life, right? I mean, this is something which every person has to go through from adulthood to as they grow, right? So there is a problem statement, and therefore there's a genuine need to solve for it, and that's what I figured out when I met both of you separately. So why is it underestimated? Because it's very obvious that someone has to solve for it, or is it just that you have more access to knowledge and information and temperament has improved, and therefore you realize that the ability to seek out for a solution is more right now, which was not there earlier?
So
Well,
I think
for me, market should have been there like even 50 years back.
market was always there, like you said, even 50 years back, and people are solving for the need state for sure, right? I mean, if you go on Amazon and look for Shilajit, which is largely being positioned as Takat ka supplement and Takat ki dawa, and Shilajit, I mean, if you sort it out, you can get a 180 rupee Shilajit to a 40,000 rupee Shilajit on Amazon, at least 25,000 rupee pure Shilajit from the Himalayas, from the valleys of Afghanistan and things like that, right? So depending on your pocket, depending on your interest and enthusiasm, you can keep buying it. So people are selling around this. There is enough and more monetization businesses being built around this need of a better sexual health, right? The reason why the only thing is it is very it's fragmented, right? There are individual players listed on Amazon and websites. There are individual doctors who are practicing it, very few but still practicing it. There are a lot of alternate medicine doctors who are practicing it. There is this Gupt Rog, etc. So there is enough and more avenues for people to go to. It's just that it's very fragmented. The reason I think it is fragmented is because you need to kind of build the entire ecosystem in some ways, right? I mean, there is not enough qualified supply of doctors who could do this. There is a lot of education that you need to put in, and financially also it is not very lucrative because it does not involve a lot of surgeries.
So let's break down the business landscape of this space. There's a services side and there's a product side. Clearly, both of you are in each of these category. And one of the reasons we were excited to partner with both of you is because one is taking the services approach, the clinical approach, one is taking the product approach. So can you each of you break down a certain taxonomy that in services side, when you look at it, what type of the players exist, what are the incumbent versus upstarts, who is doing what, so that in general there is an understanding that what's really happening, who is solving for what is the landscape to it.
There are some people who have started doing the right kind of education, which is the sex educators and the influencers,
social
who are
media,
the social media influencers, YouTube, etc. So that's education and realization, and then solutioning in terms of treatment from a services perspective. On one side you have independent doctors who are psychiatrists turned sexologists. Sexologist is someone who has kind of got specialization in sexual medicine or trained in sexual medicine. Some andrologists who have also done specialization in sexual medicine, or psychiatrists who have done kind of subspecialization as an andrologist.
Inside hospitals, or these are private clinics?
These are mostly private clinics, right? Some of the doctors have, like for example, there's a Dr. Praveen Tripathi in Noida. I kind of used to follow him. I still follow him a lot. He has made it like a small setup, a fairly big setup now, where he has trained doctors and sort of a mega clinic of sorts, where they kind of he's treating and he has doctors who are now treating, etc. Right? But this is all largely fragmented. On the other side, from a services standpoint, you have alternate medicines, which is again highly fragmented, and then quacks, which is all over, right? So that's the landscape of people who are trying to solve for this need of sexual health treatments from a services standpoint.
And the stack is that user would find out who these service providers are, do a consultation, and then the expert sexologist, urologist, or endocrinologist would talk to you and then recommend you a certain program. which
Just
you have
like
to
it
go
happens
through
in
that.
any hospital or in any clinic, you will come talk to the expert, share your problem, share your apprehensions, share your medical history. The doctor, and in this category, what is definite is the patient would have researched a hell lot before they are meeting the doctor, right? Because they would want to self-diagnose it as much as possible, identify. The patient would want to understand the diagnosis and the root cause around it, and then what is the possible solution. And they get a prescription of sorts which has recommendations around lifestyle, recommendations around the medication that they should take, if there are any tests that they should do. Therapy is something which we play very big on. India is still not ready when it comes to adoption of therapies. But I think it plays a huge impact in terms of the overall well-being and overall sustainability of treatment. Right?
What therapies is these are psychological therapies?
So largely CBT therapies around premature ejaculation, and then obviously, so if I take that as an example, what happens in a typical treatment around premature psychogenic anxiety, performance anxiety, or psychogenic P, is you take medications, and if and doctor qualifies whether you are eligible for that or not with certain other parameters, and then you take medication, it will largely get fixed, or at least you'll start seeing improvement. Then the next obvious question that the patient would have for the second month or maybe the third month is, doctor, iska karna kya hai? Do I have to take this lifetime? And the answer is no. And that is where you have to start kind of replacing that by building the confidence, and therapy sessions actually come there. They are standard techniques, just not executed well in the market, right? Which we do. We do a very capsule therapy sort of a session. I mean, it's not like a shrink equivalent concept where you keep doing your sessions and you do 10, 15, 20 sessions. We want session 1 to have a very specific agenda, session 2 to have homework, session 2 will have a very specific agenda of its own. The therapist will see whether there is improvement or not. If required, they will give more homework, and then you see session 3. Hopefully, it should give the desired result. Like that's the most common happy flow for the treatment around PE, and similarly it goes for ED. ED plus PE is also erectile dysfunction, and premature ejaculation is also something which is a very, very common thing, which is both the things combined, leading to largely low desire and then induced PE and all of that, right? So I think in terms of the landscape, services based, it exists, it always existed, but it is highly fragmented.
Not organized.
Not organized.
And digital first.
It is physical first by and large. Digital first is aggregators making it more digital first, like the Practo and the M-Fine, and when it was.
But in your case also, you're also digital first, where people can directly have a.
We started as pool of doctors trained under a protocol as sexual medicine experts available online. But then eventually we moved to a more footprint-driven physical spaces, and now have both the business.
Yeah, I want to come back to you on that consumer behavior. But on the product side, what is the landscape?
For a lot of men, there is no easy easy avenue to go to solve these problem statements. Like there is no top of the mind recall solution that, okay, I'm starting to face these problem statements. What should I really be doing, right? The space was completely disorganized. What we are able to do is a set of products and let's say a set of free consultations that we are able to offer to a customer, they're able to come to an outcome. One view maybe that I differ slightly on is, like psychologists, for example, right? And I do agree, like for a lot of men, the issue is psychology, but I do also sometimes feel that what ends up happening, especially in India, is because a lot of psychologists end up becoming like sexologists. For them, every problem is, this is a psychogenic issue. So a lot of times, a lot of cardiovascular problems get bucketed as a psychogenic problem statement, and those sort of tend to get missed, right? But yeah, so what the way let's take an example of, let's say, PE, right? Now for us, we have products in 3, let's say, possible realms, right? It starts, let's say, with something which is basically a Schedule H solution, which is going to be a depoxitin. Now, this is going to have maybe the highest efficacy rates. It's going to be something that would require a mandatory consultation. We offer free consultations, for example. The second bucket would be like a lidocaine spray. So in India, circumcision is not very common. There is some science which basically says that, if circumcision happens, right, your penis head is slightly less sensitive, which leads to PE not being maybe as big of a problem statement, right? If circumcision is not sort of cultural, the rates of PE are actually higher in those populations. And in those cases, extent is going to be a really, really effective, really high outcome solution, right? So for example, in that product range, from the point we started to now, I mean, we are, online maybe the largest brand in that sort of product category, right? It's a 40-45 crore plus annual category that 4 years, 5 years back was completely non-existent.
That's a time.
Well, I don't think it's the time. We have not even scratched the surface in terms of that, because I mean, it was just non-existent 4 years back when we started it. There was like no brand that you could really find solving it. And now, you will see some of the bigger brands trying to sort of replicate what we have done in that category, right? And then you would have some alternative medicine, and those will have limited efficacy rate. The point there is that you have to be very honest. You can't have Shilajit as a all-in-one 100% efficacy solution. You have to be very honest with what it does. But that is the way we look at it. And then with everything, we'll offer a free consultation. The point becomes that no matter what you want to go for, whichever bucket you want to go for, there will be a doctor and an ICMR recognized doctor, like a specialist, who will come and tell you, okay, yeah, maybe this is the right avenue for you to, or maybe, you don't need to do anything, right? Maybe the avenue for you is CBD, cognitive behavioral therapy, right? You need to maybe go and visit a psychiatrist and have a session to really solve, those problems, to really solve your PE problem statement, right? But that is the way we try to solve it. We go from a product first angle and then add consultation as a free layer behind it, which makes it easy for men to come and avail those problem statements, So,
and what are these products? Let's say one is...
So that is the sort of breadth in terms of like PE as a category, right? I mean, in ED, the high efficacy solutions are going to be like a sildenafil or a tadalafil. The difference in sildenafil, tadalafil is basically half-life. Like sildenafil, you take it about 15 months before intercourse. Tadalafil...
15 months?
15 minutes.
Minutes? Oh, I heard 15 months. What kind of a performance you want?
Yeah, and that'll be some crazy half-life. Yeah. Or tadalafil, which you take every day morning, because that's slightly longer half-life, right? And it depends, if you're let's say a married person, you don't want to take a tablet every time, so it's better for you to take a tablet every day morning. So you would see some of the largest brands in the country having, let's say, certain products, let's say, certain Shilajit based products, where the ad that they will run is basically like a sad couple, the guy takes a tablet and it's a happy couple. That's what are they trying to, they'll not be able to directly say it, because then it's like a DMR case that goes on them, like a Drug Magic Remedies Act case goes on them, but then, indirectly they're sort of pointing towards it, right? I mean, there are a lot of those small energy drink, not energy, I don't know what you call it, prebiotic, probiotic type drinks, that their early versions of the ads used to be like, focus on that, right? So you'll find that on one side. You will find legitimate solutions, right? A very common experience for a lot of men is to go into a clinic and do like a V with their finger, which is basically what they're trying to indicate is, whatever variant of a Viagra that you have, let's say, can you give that to me, right? You don't know what you're getting in that case. It's one of the most adulterated products out there. Like sildenafil is one of the most adulterated products, because most of the people who buy it, unfortunately buy it without a prescription, and it's an awkward conversation. Like, you don't go to the pharmacy nearest to your house, you go to something that is like 5 blocks away, and you hope that the guy understands what you're trying to ask for, and doesn't smirk or doesn't have that look on his face and quietly gives it to you. The problem is such that, I mean, if you look at like Maslow's hierarchy, it's like ghar, khana, pani, intercourse. It's core, it's like they need to solve it once they start facing it. So they become desperate. They'll go and try, folks who are saying this is a magic remedy for all problems, they will try sort of sildenafil or like whatever, but where they don't know if it's, if the source is good or if it's manufactured in the right way. They will go to the Omni car on the side of the road, which will be like a Japani oil, which is like, put this oil and everything will happen, everything will start working. If I stop somebody on the road and tell them, ki, hey, tell me a good men's sexual health brand. I mean, I hope that they now start saying Boldcare and Allo, but they generally, I've done it like thousands of times now, In fact, maybe in the first conversation, I had asked you the same question as well, right? You tell me like, what's a good men's sexual health brand? People don't have an answer to that question, right? So that is where that avenue comes for a lot of people to come and do whatever they want. So for me, it was all about like, can I organize products that truly work and, promise with the right, present them with the right promise, give a free consultation with a proper doctor, not an, like an alternative medicines doctor, and make that as the easiest avenue for you to maybe solve the problem statement, right? But yeah,
I mean, see, in this category there are two things generally in health I've seen is that one, your ability to measure progress, that drives retention, right? And second is building trust, because in healthcare that's the most critical anchor to build a brand and a brand recalling, right?
Yeah.
And this is a tricky space, right? How do you measure the progress? Someone has to come back and tell that, I've been having, better time with the partner and I feel better, while having an act.
Yeah.
but you also don't want them to be on the products or the services for a long time. So the retention is also, the LTV so-called is very defined. At the same time, it's a huge Herculean task to build trust, because this is not something you just pop up to build muscles, right? So how do you go out and build these two vectors?
Fundamentally, what we have been doing is what is the right thing for the patient, and eventually what is the right thing for the provider, which is the doctor. So I'll probably take one at a time. For a patient, what would they want? They definitely don't want to go to any hospital or any healthcare intervention. They would want to be fit and healthy and fine, whatever health it is, right? So they are anyway seeing you as an intervention, which is like an intervention that they want to do and get rid of so that they can get back to normalcy. So, and most public health systems are in line with how patients would want, right? I mean, most public health systems would have a queue system where their goal is to get the patient out of the queue as soon as they can. We're following the right protocol so that the queue is available for other people to kind of leverage on, right? We have built a system which is a lot more inspired on that. The core of what we do is effectiveness. If there is no outcome, there is no business for us, right? And people won't trust us, and it's a cycle, right? So, I mean, you'll be surprised to know that out of 100 patients who come and talk to our doctors, more than 75 to 80% of them actually come back after a month. Some saying that their problem is fixed, some saying that they have seen improvement, some saying that they have not seen improvement, right? Or they have not seen any change, but they do come, right? And I think that is one thing that we've invested a lot in terms of patient journey on how, because in healthcare, especially in India, is not optimized, and healthcare systems are not optimized for the overall outcome of the patient, right? It's only very intervention based. So for us, the end outcome is when after 2 or 3 follow-ups or 2 to 3 months or whatever time it takes, the patient is satisfied with the solution. And the way to measure is not objective. I mean, it is objective to some extent, but it is again to the expectation of what the patient would want. There are more methodical ways of understanding progress, but and we started with that. There are like some 8-point scale, etc. But then I realized that there is no point of doing any of that. So long as the patient feels that there is improvement or not is the golden metric that we need to follow.
One step back, the fact that this category hasn't been created at scale so far was because there was an apprehension of the patient to make a reach out, or there were other people who were playing on the vulnerability. How can someone build a trust? Because for you to build the trust to say that the problem exists, like, I mean, every 1 in 10 men have the problem. How do you make that one person feel comfortable and confident that, okay, you should come and talk to me?
So this is a category where referrals are very low, right? I mean, and that is the reason.
Because people will obviously not tell the other person that I had a problem and I went and met.
Even if the problem got fixed, you're not going to share. If it didn't get fixed, then you're not going to share. And that is why these quacks exist even after like 7-8 decades of independence, right? So that was something that we knew before getting into the category. The only way you can differentiate yourself for people to eventually trust you is through your communication.
One thing I've seen, and I want to have you talk about that as well, is that amongst, let's say, other companies where you could say that I solve for diabetes, you can have a transformation of a person. I solve for weight loss, you can have a testimonial of a person. Even to an extent of PCOS, a lot of factors. But this is a category where things are fairly anonymized for the fact that people don't want to and can't come out and talk. Then that example of credential establishment doesn't exist. You can't make a point to prove that I've solved for this person and no one is there to give you a referral in public, right? So it then becomes extremely hard to even build a credential that this is a product or this is a service which is actually moving the needle in terms of outcome.
What at least we have seen in our experience is there is a strong desire for men to solve the problem statement, So then your early adopters basically try to find you. And then from there, the journey sort of starts for a brand to make, sort of put yourself in the right way in the market where they know, okay, this is an avenue for me to come and solve the problem statement. Right? Trust is, retention is basically going to be a key way for you to figure all of this out. Like if you are basically selling like beard oil, if you put beard oil, your beard grows regardless. You don't know how effective it was. But then if you say somebody, Carrie, this is a solution for ED or this is a solution for PE with a certain promise to them in terms of how quickly it can act and what it's going to do for you. And if it doesn't do that, they immediately know, okay, this doesn't work for me, right? And because the problem statement is getting younger and younger, there is a higher desire for them to venture out, at least in our case online, to find a solution. Again, that works in at least in our case, but let's say they figure out, okay, Boldcare is maybe an easy avenue for me to solve it, then it is all about retention, right? If that person comes in and we see, oh, there is a very, very strong retention happening for the brand, then we know, okay, this product is, these products are truly working, right? In our case, I mean, if you see the online sort of landscape of men's sexual health, there is about a 17 to 20% market share that we have been able to sort of capture in the last 4.5 years. And then you need to have enough confidence in your set of products that, okay, if they come in and if they get the right set of products and if they try it and it's really working for them, then, then you have gotten to a successful outcome, right? For us, at least, it's a very good outcome if the customer eventually stops coming to us.
Yeah,
because, they have actually solved the problem.
So I was saying, this is something which has been on my head for a long time, that ideally in this category, your LTVs can't be long enough.
But I'll give you an example, right? So we eventually in the second year of our business got into the sexual wellness side, which is the condoms and lube side, right? Condoms are very low AOV products. They're about, 149, 129, 179, 199, maybe 99, right? And if you're building an online business, there is a certain CAC associated to, let's say, launching a new product category, right? A customer acquisition cost. Generally, if you're online, the CACs are going to be whatever, minimum 250, maximum 850, 900,000 rupees, right? It is considered a pretty horrible idea to launch a 149 rupee product online, because you'll never be able to build it as a product category. For us, the idea was that, okay, there is enough goodness that comes into the Boldcare brand name because we're able to solve this problem statement of, let's say, sexual health, that they would be keen to go and explore that, okay, Boldcare is now doing a condom, how would it do, right? And that has been an experiment that worked great in our case. We're the fastest growing condom brand in the last 2 years, right? We sell more condoms than some of the largest brands that you can think of that have existed for the last 4 decades. Close to 20% market share just in that as well, like just in condoms and lubes.
And what is the differentiator here? Like, condoms as a category has existed for long.
Yeah.
Why would someone want to go out and experiment a new brand?
First of all, the goodness in the name of the brand, that people are ready to trust it. Okay, we figured, okay, why not start having disposable bags in our condoms so that you can dispose it off safely. You don't want to throw it in a dustbin or throw it down the window, right? You can't do that. So if you have a disposable bag, you can put it inside the disposable bag and you can just sort of stick it. You can easily dump a condom anywhere. Those small thought processes really had a big impact, because our retention just in condoms is actually higher than any brand.
Could be change in the customer mentality, right? I mean, disposing as a use case, I'm not sure would have been very conscious for someone, because condoms might have been used for like 40, 50 years, right? But 10 years before or even 5 years before, people might not be thinking about disposing as a sustainability as an angle.
Small factors start affecting, like they start adding up, right?
Right.
How we do the packaging of the product, you can keep it on the table and you'll not really have a problem with it, right? But it's, your brand is working if people are coming back, and it is good if they eventually stop coming back because of the root causes have been solved. And as a brand, you should be happy because you've done what you said.
What is the moat then? Is trust the moat, or your ability to drive an outcome and give you the solution is the moat? What is the moat?
I think from a business perspective, trust is what you want. How you get it is, in my opinion, in a healthcare business, it is by delivering consistent outcomes. The training academy that we have, where we train doctors, right? The entire idea behind this was that, doctors should not do treatments their way, because it's science at the end of the day. So it has to be objective in nature. So we have created like more than 380, 400 pathways for using our data. Like we have seen like more than 1.5 lakh patients so far over the last 3 years now. And, while most of it falls under the top 15, 20 pathways, there are long tails of pathways as well, right? And every doctor which comes on board, regardless of their experience, regardless of their specialization, mostly psychiatrists, but there are some internal medicine, a few MBBS doctors as well, they have to go through that process before they come and start seeing patients, right? There is a very strong productization that we have done for them to ask the right questions to the patient to get down to that pathway in a much more productized, error-free way, and then kind of enable them to suggest the right diagnosis and the right treatment around that. This was possible only because we went deep into this one category and took a very healthcare-ish services first approach. For these consultations, we definitely charge, right? But the way, like I was saying, the way we build trust is by communication. So none of our consultations have ever been free. But if you're not satisfied, you will get a reconsultation. If you're not satisfied, you will get your refund, right? And those are the things which drive a lot more trust than anything else that is available out in the market, right? I mean, similarly, when the doctor explains, I mean, we have cues which we send to users, to patients, to articulate their problem well, because oftentimes when the patient is saying in front of the doctor, whether it is a video call or it's an in-person call, they are articulating that problem for the first time for anyone. उन्होंने अभी तक अपने मन में ही सोचा हुआ है कि क्या प्रॉब्लम है और ओनली गूगल्ड इट, राइट? सो हाउ डू यू काइंड ऑफ एनेबल दैट सो दैट द कम्युनिकेशन एंड द कंसल्टेशन इज मच मोर इफेक्टिव? सो दोज आर द स्मॉल लिटिल nuances which we have solved for, and the entire patient journey product that we have, 75 to 80% of the people actually come back for a repeat consultation with the same doctor, is actually all designed with an intent to deliver outcomes, which eventually over the long course would, that plus the education layer that we have, the content layer that we have, will together accelerate the trust in the brand, is how we look at it.
What have you learned about human psychology while running this business? Because this is all about behavioral psychology.
I think the humans in general think a lot about themselves, which is true, and are in general very anxious about being judged. We are solving a problem which deals with individuals' insecurities, right? People suffering with sexual health, trying to read about, trying all the lotions and potions and everything, buying Viagra out of the shelf, meeting quacks, talking to a friend. All of this is because they don't want to talk about it and they want to solve it by themselves. And it is not just for men or for a particular gender, or it is across humans, right? I mean, they are so insecure about themselves, and the stigma around, which culturally, societally, that we have developed just adds to it, which I think needs to change.
I'm sure there would be a lot of bizarre and funny moments. So what has been customer feedback or an email? Someone might have reached out to you which has stayed with you for a long time. Anything funny, anything bizarre?
In the first version of our website, or maybe the second version of our website, you can say. So very early into the journey, we used to do our own customer support because koi tha nahi team mein. So me and Rahul used to do the customer support job for the first maybe 2-3 months. So there was this individual who had sent a letter to us talking about how, and it's not funny, but it's something that just sort of stayed with me for a very long time, right? He sort of he sent a letter saying that, how he was about to get divorced, and sort of what situation he was in, and then what he was, sort of what we were able to help in our own little way to get him to, right? Where his interpersonal relationship with his partner really, really improved. And it was like a sweet letter. Like, we have never gotten an actual letter from somebody. And then we requested him, sir, do you think we can put this on our website? Obviously anonymously, but I don't know if there is any way to figure out how our older website would look, but you would see that there was a whole letter ka picture that used to be there on the website. Then we eventually dropped it, but it was there for a good 3-4 months. So that was a very early experience where...
Did you go back and check back him? How is he doing now?
Yeah. So, he was a very young guy. Didn't need to use our products for a very long time. The idea for him was, and that is what the doctor eventually told him as well, in the first consultation, basically, you need to use it till you are able to get confident about yourself. And he eventually got very comfortable with his partner. That problem actually, he was done maybe using our products in like 2-3 months and never needed it, right? So yeah, I mean, I do know what the conclusion to that story was. Yeah. And we were we were so small, and like hum khud hi kar rahe the customer support calls, so like we would really know, and the team was like 6 people or 5 people, right? So we were like on WhatsApp at all times, right? So I mean, that's one that has always stayed with me.
In your business, I remember you had told me last time when we met that a lot of traffic and audience is offline right now, right? Yeah. So has it happened? So, and that was surprising to me, right? Because I thought this is a category where people don't want to expose their identity, and therefore calling up on a call or chat is much more ideal than showing up in person. So, any experiences from that point of view that people prefer to reach out to the founder directly or through offline connects rather than going online?
So I think there have been multiple occasions. On my LinkedIn, every month I see at least 2 or 3 requests where people have written that they have tried our services, they have gotten better, or they are in the process of getting better, and it is very personal for them, and they want to figure out a way to work together with us, either as a consultant or as a freelancer or as a potential future employee, right? In the initial days, about 1.5 years back, a renowned cricketer's wife reached out personally to me on an email saying that, this person is this, and I don't want them or him to book, sessions, but I want to come in as a couple and figure out what are the solutions around that, which to me felt was a very important need to kind of figure out, and how do we kind of ensure data security, how do we ensure that, platform security and data security is something that is maintained, and we kind of worked our way through it. On one occasion, there was a 16-year unconsummated marriage, that the couple was going through, and they wanted to kind of have a baby. They came, with the pregnancy news, after the treatment, once they kind of got diagnosed, got treated, and then they came with sweets, and then they were kind of having photos, etc. So I think this is very, very common, more common now in the clinics, because now they have a one-on-one personal connect with the doctors. And and also now it has a ripple effect online as well.
Products like a lube or a condom, these are mostly sold on quick commerce right now. Specifically, I remember talking to a founder who's again building in the women pleasure category, and she was telling me that most of her expense in the COGS is on the packaging, because you can't have the delivery person judge the customer basis on the product type. Is that a challenge? Because a quick commerce guy will just put the packet and ship it with other 10 things, right?
I'll speak on both sides, right? What happens on our website and maybe even a little bit on the quick commerce side, right? On our website, we do take care of it, right? A fundamental part of being online is to provide privacy to a customer, and that entails us. So as an organization, we actually don't work with any third parties. For us, we have completely built everything in-house. The idea of that is to maintain sort of data privacy, right? There is no marketing agency that we work with that is able to get access to any data in the organization. In the organization also, the data is siloed, where actually beyond a certain set of, let's say, the technical team or, maybe few folks, the data is siloed, right? Nobody is able to have access to, who's the customer, where is it going, what is happening. So, and then also when the package is made, we keep it anonymous, so that when the delivery is happening at your doorsteps, the customer can be rest assured that whoever is delivering the package would not know what is there inside it, right?
This is when someone orders through your website.
Yes, when somebody orders on our website. So that anonymous packaging is something that we take care of, right? So that is something that we can offer, because on our website, even that free consultation, right? These are sort of special value-added services that we can do, because that whole experience end-to-end is controlled by Boldcare. So that is something we can do. But even on quick commerce, what we have eventually realized, and the reason we, or the category of like condoms and lubes do so well, is because, let's say, if I'm ordering on one of the three sort of main platforms, right? I know that this order is going to come in 10 minutes and I am home, right? But let's say if I am ordering a condom and I know it's just about to come to my doorsteps in the next 6 minutes or 8 minutes, I am the one who's going to be opening the door. I'm the one who's going to be taking it, right? And also now they've started adding anonymous packaging. So now on like three platforms, you can sort of put a toggle up that I want to. In fact, I think you can also delete order history now, that you can set up that this order should not be saved. So I think these platforms are also starting to take care of that. But that is a reason why sexual health and wellness as a category, very specifically on quick commerce, is doing really, really well.
It is growing much faster than what it went on the e-commerce, and largely because of the same reason, right? Because I know I have predictability on when to collect the order, right?
And who's going to collect it?
And for us, it's a very similar story. Like a lot of patients who take consultations online want to collect their medicines from the closest clinic, because they don't want medicines to be delivered, because they live with other people in the house who they don't want to, and they want it to be more discreet. So they're like, we will buy it ourselves, or you tell me where to collect it from, I'll come and collect it, because I want
so like a example that happens in our case with this is sometimes customers will call us, and we sort of, what we do is we give them a personal sort of an agent on WhatsApp to speak to. They
change the address.
Yeah, so maybe it's not change the address, but they'll say, okay, can you request the delivery boy to come to this specific spot, and I will go and pick it up from him, right? So we are able to sort of figure that out with our delivery partners, that okay, just go and stand at this specific point, the customer will come and pick it up.
While you were talking to him, I'm trying to figure it out, because that is very culturally ingrained in our in a society, that identity and how someone will perceive for it is also somehow linked in that customer trust and acquisition approach, right? And you had created a video campaign earlier this year, and it just went viral. Talk to me of that process, like what went in creating that approach, which was also not direct, and it went viral.
Exactly. So for me, the idea was that, this is a space that desperately needs people to come out and create, noise and be very loud and vocal that, okay, there is this company that exists in this category to solve this problem statement. I think that is something that largely was never done. It was super hush-hush, even a lot of marketing, it's very hush-hush that, okay, come and we can privately sort of solve this problem, which is true. The mode of actually solving it for a customer is completely private, but we wanted to be sort of loud about the fact that we solve this problem statement out there, right? So we knew that if we put Johnny Sins, a character, he's,
What made you think about that character?
See, basically the idea was very simple. We wanted to show that even a person like Johnny Sins could face this problem statement. And even when we approached Johnny, right, he found it very exciting that he's like, okay, you're going to make me as the person who's facing ED or a P as a problem statement, right? And that, that was something that we wanted to get across, that actually anyone can face these problem statements. Could be psychogenic, could be something else, but this is a common enough problem statement that anyone can face it. That's what we wanted to get across in that Johnny, using that trope of somebody like him who's seen as uber masculine, that, okay, he can also
That's the guy you are otherwise watching as a content.
Yes, and you sort of expect him to never have these problem statements, right? So we work with the right team, be it like Tanmay or, obviously Ranveer is a co-founder with us, right?
So Ranveer, tell me about, again, brand reputation, a product, a category and a product and a company which is in a taboo sector. What was your pitch to Ranveer? Because he's also an investor in your company, right? What made him invest in you?
I'll tell you, like, when I met him for the first time, the idea was that it's supposed to be like a 10-15 minute conversation, because I'd sort of requested somebody in his team that, can you just get me in front of him for like 10-15 minutes, right? And I wanted to just tell him that this is what I solve for. That about 10-15 minute conversation became like a 2.5-3 hour long conversation. He knew how big the problem statement is and that somebody needs to be there to solve it, right? He has worked with one of the other brands in this category in the past. Obviously, that was very specifically on condoms, but he sort of understood the space, right? Then, he could sort of figure out that we want to do it in an honest manner. So that synergy was set there. Obviously, he was gracious enough to work with us, and that relationship developed, right? The fact that we actually want to be loud and clear that we are a men's sexual health company is something that he found very exciting, because a lot of brands would want to solve this problem, but then have another sort of overarching view of what the company stands for, right? They will not openly say that, okay, we solve in this category. I think that is one very big thing. Like, if you're solving it, it's a problem statement that so many young men are starting to face, then you better be honest and loud and, be clear that, okay, I'll solve it honestly for you, right? So,
do you get any patterns when you work with your channel partners that most of the orders come from a particular type of part of the city? Is there any patterns to figure it out?
When we started, we were 80% like metros, like the top 5 cities was 80% of our volume. But now, in the 5th odd year of our business, it's basically become where, let's say, the top 20 cities from a population sort of perspective, that would account for about 65-70% of our total, let's say, the customer base comes from there. For rest of India, which is the way they look at it, is like we go beyond the top 5 cities. So top 5 is like, take the top 5 cities from a population perspective. So we are number 2 on an overall India perspective. But if you go into the rest of India bracket for them, which is beyond the top 5 cities, our market share is actually almost equal to the number 1 brand. So that is now a trend that we are able to see, that a lot of tier 2, tier 3 India is ready to trust Boldcare and, come into, try to use our products.
Is it because your brand awareness is increasing, or because the incumbent company was late?
I don't think they're late. I think everyone is sort of on the ride now, but I think it's more to do with just the brand awareness increasing, right? And there is, the trust sort of accumulates in this space. The more you do, the better it sort of gets, the longer you exist, and there is the more goodness you're able to get out of it. So that accumulation effect is starting to happen at least in our case now.
In your case, when people are coming into the clinics, right, I actually have seen the name boards right in the middle of the road.
Yeah.
Right. So I was wondering that while someone is driving or walking, you can see actually Allo Health as a name board, and I've seen that in Whitefield. I was telling you, right?
Yeah.
How much of that approach has actually helped get walking, or is it still, discovery based, people finding and then coming?
It's both. So I think the idea that we had and the approach that we took was largely to create a lot of content that people can trust and rely on, and that content stays around, right? Be it on YouTube, be it the blog pages that we have, etc. And create one single source of truth, which also has content from other partners which we have verified and which we know is factual and correct, right? And we have seen that people take a lot of time before taking the plunge of kind of going for a consultation with a doctor, right? And these offline clinics and prominent branding outside the clinic actually helps a lot, because it closes the loop for the recall that they would want. And we see patients coming in saying, I go from my office to my work, home from to work, or home to office every day. And every day I see this. Every day I think I'll come and, have a chat with the doctor. Today I finally got the time and the space, mind space to kind of come and talk to the doctor, and I'm doing it. At the right time, when you're ready, you can either go for an online or for an offline consultation. The most important thing and the most obvious thing that they're doing is searching about their insecurities or searching about their queries or problems that they have, because they are not discussing it with anyone, right? And that is where we see, when it comes to clinic, cities where we don't have clinics, like in Bangalore, we now have 10 clinics. In Bombay, we have 10 clinics, right? Cities where we don't have clinics, there is a very strong online demand push that we see. But cities where we have clinics now, like Bangalore, the online proportion of demand is significantly reduced for us, because people want to go to the clinics, contrary to the popular opinion that we had or hypothesis that we had, that this is a very personal problem and people would not want to kind of go and talk to a doctor in person. But that is not the case. People do want to go to clinics, want to discuss their problem with the doctor one-on-one, and then get a resolution.
And what do you see when people come, in your case men? Do they come usually alone or they are coming with their partners?
So about 70% of the times men come alone. About rest of the times it's generally two people who come, and then in some cases women.
And
also
in
come.
your case, since you're seeing the customer coming, what's the age category? What's the
So I think when it comes to consuming content and asking questions online, it is, the highest age bracket is 18 to 24. People taking assessments to know whether they need an STI test, whether they want to, whether they have mild erectile dysfunction or strong, and things like that. And we have a lot of these online. For these things, we see 18 to 24 being the biggest traffic generator. But when it comes to people booking consultations to meet, to talk to doctors online, and patients coming to our clinics, the biggest buckets are more 24 to 34 and then 34 to 40. Yeah.
Both of you guys have now raised a lot of money, right? What is one thing which you feel investors still don't get about this category? By the way, as a disclaimer, I want to say that we've partnered, Rainmatter has partnered with both of you, so we get it. But my question is, what is that in your conversations you think investors are not getting it?
I mean, we are building a healthcare business and we are building it for the long term, right? I think it's a 10-20 year game that I believe we are playing. And, there is a very, very strong focus on building the foundations, right? In terms of what the company stands for, what is the focus on, how the way we want to build, the principles on which we want to take patient experience, how do we want to nurture the doctor ecosystem and the entire clinical ecosystem, what is our strategy on content. All of this leads to slower but steadier and sustainable growth, which is usually very hard for a typical investor to guess and understand.
You have ton of investors. What has been your experience? What did others didn't get?
I think two things, right? One maybe is the TAM question that we've already sort of, had a briefly spoke on that. But TAM is a question because it's not that easily, there is not enough, data available.
There's no number
online.
there.
Here the main problem is, people, and which is where I think the opportunity lies, because of how disorganized the space is and you can't even get a TAM number. I think that is where you would want to go and try to solve a problem statement. Second for us used to be, which is not the case thankfully anymore now, we have had fairly unique journey in terms of fundraising maybe for the first 3.5 years, right? A question that we would keep on getting is why has there never been a brand in the space before, right?
When I get a lot of messages, people asking, hey, how do I lose weight? How do I stay fit? You seem to have gone through a transformation. A common pattern for me, whether you want to lose weight or not get into a diabetic level, is stay healthy, eat right, move more, sleep, and try to regulate your stress levels, right? What are the few things which you should do not to find yourself into an sexual health problem? And I know both of you are not experts, you're not medical doctors, that disclaimer is out there, but someone who has seen through tons of customer experiences, there might be some patterns what you would typically recommend. So what are those?
This is very simple rules, right? But number one is, at least 3 days of like aerobic fitness and maybe 3 days of strength training, right? Or how much ever you can do, even 15-20 minutes a day, 30 minutes a day. But I think moving around is going to significantly have an impact on your cardiovascular health. Sleep at the same time, wake up at the same time, possibly get 7.5 hours of sleep. Ideally sleep by 10:30, 11:30, wake up as early, 5, 6. And number 3 is, and this is maybe a little extreme, but I do feel everyone should get maybe a blood test done every quarter to get a track of what is happening with their sort of profile, right?
By the way, I mean, I wanted to ask you this, right? I remember in your slide, most of your therapists are women,
Yeah.
right? Why is that?
No, I think we have about 60% of therapists are women. When it comes to doctors also, we have about 60% of doctors as women.
So I had an impression that this is a field where women as expert might not be comfortable because they have to talk on topics which is not, natural to them. But in your case, customers are mostly men, and then women are the therapists. So what is making more women come into this field?
So I think in tier 1, which is where we are majority right now, majorly right now, we have not seen this as a challenge. But as you're moving to tier 2, as we have clinics in Mysore, as we have clinics in Ranchi, that is changing. I mean, there is a very strong preference of patients in terms of patients have a preference. The doctors, being a doctor, don't have a preference. And this is like across geographies, across markets that I've seen, right?
So the male patients have a preference to talk to a female?
No, to male patients now. I mean, they are also indifferent. Largely speaking, in tier 1 cities, it was not a big challenge. In online and in tier 2, we have seen people showing their discomfort around talking with a female doctor. But doctors per se never had a challenge, right? So now in certain geographies, like we have a clinic in Vashi where there's a combination, right? There are male doctors who sit for certain days, and then there's a female doctor which sit for certain days. So I think as we are creating a denser network in cities, we are kind of optimizing for preferences from the patient's side with their notions around who they should show it. But doctors have never had problems seeing patients in general. Yeah.
We spoke about capital, right? If tomorrow you get $100 million, what is the one thing you would want to immediately deploy to bring impact?
That being said, I think 100 million is a lot of money. I don't think that much is needed. But I think on our end, because we're trying to push how much bigger can we get and how many more folks can we service, I think it would get deployed, number one, on the education front. I think we will really start investing even more heavily into how we get in front of customers and the content we are able to put across. Also just expand in terms of how many folks can we service, right? And how we are able to do it. I think that is where, number one, our avenues go. We are also a products company, right? So for us, getting into that offline network of, let's say, getting into pharmacy stores, that is also an avenue. That being said, we are largely online right now, but I am assuming a little bit would go into that realm as well. But yeah, largely online, expanding the category.
If it is something that we don't have to return, then I would invest all of it in sexual education, right? But if it is something that is more like an investor money, the most important thing is creating more doctors who are trained in sexual medicine, because I think that is what is the root cause of everything. I mean, the dominance of alternate medicine, quacks, etc. is all because, this industry is very supply constrained. So I would rather deploy a large part of that money in creating institutes or avenues for doctors to get trained and have a continuous learning, maybe tens of thousands of doctors, and then obviously creating more awareness, education and sexual health awareness. The third part is, I think, and we have about 25 clinics across 3 major cities right now, 4 major cities: Bangalore, Mumbai, Hyderabad. I think we should definitely do it. I would want us to have at least 1,000 clinics, us or whoever else wants to do it. 1,000 clinics which are doing medically, clinically proven treatments for sexual disorders, across different markets.
I think the idea, like I said, was to unpack a lot of this category from a consumer point of view and from a creator point of view. At Trade Matter, we are super excited to be partners to what you guys are building. Really appreciate you coming down and sharing all those insights. One last thing before we wrap up, there are a lot of aspiring entrepreneurs who might be listening to this podcast, specifically in the health space. What is this one thing they should keep in mind while they think about starting a company to solve a health problem?
I think it is perseverance, right? I mean, having the sort of resilience and clarity in terms of why you're building what you're building, and then being at it, right? So I think there are two parts that I'm saying. One is you should know the problem that you're solving and the reason why you're solving that problem, and then being at it doesn't mean that you have to be obsessed about it. You have to be obsessed about the why and the what. The how will keep changing, right? I mean, the way you navigate to the problem and solve the problem will keep kind of shifting depending on the market, environment, etc. But I think clarity around the why will help drive that perseverance to the problem.
He's right, perseverance is sort of important. I think two more things maybe in, let's say if you're specifically building in healthcare, you have to be outcome oriented. If you're not, that will, and you have to sort of be honest in the way you will be in front of customers. I think that helps, number one. And number two, at least in my experience, it is challenging in the beginning from an investor perspective as well to sort of put yourself across and sort of explain how you are the one who's going to really have an impact on, let's say, a certain problem statement. It over time starts getting easier as you get more and more, sort of traction, sort of history to the company, whatnot.
So on my side, again, I have a vantage point of being on the other side right now, meeting a lot of entrepreneurs. I think few things, exactly what both of you said. One is you have to be very, very focused on driving an outcome, which means whatever you are trying to sell as a solution has to be very genuine. Healthcare in particular, it has to be having some kind of a medical validation to it. Second is, of course, building trust. Right? This is a category where you cannot just acquire users by throwing money because you are trying to serve a customer where there's a genuine problem, and most of this case they are very vulnerable. So you have to genuinely build trust, and trust again cannot be built by throwing performance marketing dollars, right? So you have to find ways to educate the customer, and educate here is your best marketing tool. Right? You have to find ways to build that trust by telling the customer that, hey, first I want you to educate. And if still doesn't solve your problem, probably I'll have experts who you can come and you can get their services from. And third most important is if you can get these two parts sorted, then you have a moat, which in this, unlike any biotech company or a drug company, that's your IP, right? You've literally built an IP, which is very hard. So in this case, Boldcare has a brand recalling, and Allo has a validation that is there are doctors. So you legitimately can go online and check the doctor profile. These are not just quacks, right? So if you can build a certain IP around that trusted moat you have built. So those three things are extremely important. That's common things which I keep telling founders all the time. It's very hard to build. You have to really have a skin in the game, think long term. It cannot be something which you can build for 3 to 5 years. But thank you for taking time and sharing all these insights. I think people can find you both on LinkedIn, on Twitter. We'll share your coordinates and good luck in what you're building, and excited to see what both of you are going to build in the next 5, 10, 15 years to come.
Thank you so much.
Thank you so much for having us.
Yeah, thank you. Pleasure. So that was it. Pranay and Rajat building fascinating companies. You should go out and check out Allo and Boldcare. If you have any questions, if you are an aspiring founder, you want to get some more tips or advices, reach out to these guys on an email or LinkedIn. We'll leave their coordinates. If you have any feedback or suggestions for me and our team, how we can get better, what guests you would want to listen more, send us your feedback and your comments. Thank you, and we'll see you on the other side with another guest very soon. Thank you.